Hello friends, I am Dr. Harshil Zaveri. I am from Ahmedabad. I am MDS Periodontist and Implantologist. Today I will talk about what are basal implants and are you a candidate of basal implants? So let's start with this topic. The basal implants are the special type of dental implants which are also known as single piece implants or strategic immediate loading implants. There are two jaws, one upper is maxilla and lower is mandible. In both jaw there are two types of bone. First is cancellous. The cancellous bone is slightly softer and the rate of resorption is fast, and the another is cortical bone which is also known as the basal bone. The rate of resorption of this basal bone is very less. So the basal implants are engaged into this basal bone so that it gives enough strength and more rigidity to the implants. If we compare with the routine conventional implants, the conventional implants are the two-piece implants and this basal implant is single-piece implant. The design of these both implants is also different. These implants are smooth surface implants, so the chances of peri-implantitis are very less in this basal implant system. The conventional implant should be placed straight into the jaw and these basal implants should be placed angulated. So the neck of these implants should be bent to make it parallel into the mouth. If we talk about the number of placement of this implant, in this basal implant system, the number of implants should be placed more for the success of this system. If we place less number of implant, then it can be a failure also. By the placement of this implant, the prosthesis can be delivered within the 72 hours. So, after the placement of basal implant, you can chew within the 72 hours. So, this is the biggest advantage of this system. In this basal implant, the bone grafting is also not needed. So, it is also known as strategic immediate loading implants. If we talk about the prosthesis given should be in cross-arch stabilization so that the whole full mouth prosthesis can be given into the single unit, so that cross-arch stabilization will be happen and it will give strength to the implants and your implant will not mobile and become splinted. If we talk about the advantage and disadvantage, the advantage of this system is the first, in this system bone grafting is not needed. By these basal implants, the prosthesis means tooth can be given within the 72 hours. So the 3-month waiting period is not there. Another advantage is this is a single piece system. So the screw loosening in this implant will not happen. But there are the certain disadvantages of these basal implants are also there. We cannot recommend this system for the replacement of single tooth because for success of this system, the implant should be placed more. For the replacement of single molar, we have to place 2 implants for the success of this system. For the full mouth rehabilitation, the number of implants should be placed more for the success of this basal implant system. Now we talk about when you should go for these basal implants. The first, there is no teeth present in your mouth and you want full mouth prosthesis in 72 hours, then you can go for basal implants. And you have very little amount of bone is present in maxillary and mandibular arch and conventional implants are not possible, then you can go for basal implants because these implants are engaged into the basal bone, not into the alveolar bone. So in this scenario also, the basal implants are very helpful for the tooth replacement. If patient's some part of maxilla or mandible is removed due to some conditions like cancer surgery, then in this scenario also basal implants can be given for the tooth replacement. These implants can be engaged into the zygomatic bone also or orbital floor also. So in these cancer patients also these implants can be used. I hope by this video you will come to know about what are the basal implants and when you can go for these basal implants. If you still need to know something about these basal implants, you can contact me anytime. Thank you.